both sides of the conversation family. We welcome you to this virtual space crafted especially for you. My name is Jada Curry, and I'm both sides of the conversation's marketing director and graphics design specialist. I want to take some time to ground us all as a community into this space we are about to open up in, so let's go through our community standards. Both sides of the conversation is providing a safe and honest space for open conversation, so we ask that you all be respectful of that. We also ask that you be respectful of each panelist, host, and participant. We do encourage healthy debates and conversations. Don't personalize anything with anyone. This includes name-calling, bullying, trolling, or shaming. This will not be allowed or tolerated. Your perspective is yours. It is not a prescription. You do not have to agree, but show respect. These community standards apply to all of our live shows and any virtual spaces that we hold on social media, including YouTube, Facebook, Twitter, or Instagram. We want to make sure that we are caring for each other as a community. This is our priority in all of our endeavors as both sides of the conversation. With that being said, I hope you enjoyed today's show and continue to stay in touch with us via YouTube, Facebook, Twitter, Instagram, or all of them. All right, thank you for listening and see you soon.
Welcome everybody to both sides of the conversation. I'm John Henry, Executive Director. Today is Sunday, so you know what that means. We're going to have another Sunday conversation. We're going to be talking with Dr. Monique Lassar from Rafiki Coalition and Dr. Kim Rhodes from UCSF and Emoji Health. Powerful series that we are kicking off and continuing through this New Year's Ask Your Black Doctor. We'll also give some COVID update information as well for community. So please go to our YouTube channel and use the live chat function if you would like to ask Dr. Rose or Dr. Lassar any questions today. We are getting ready to kick off this part of the segment, so we are excited. Today is the Niners championship game, so I know community is out there running around everywhere you go. There's Niner fans geared up, a large number of Niner fans in LA. Be safe out there, have a good time. It should be a great game. In today's segment, because of the game, we're going to go ahead and shorten it up. Instead of 4 o'clock, we're going to get out of here an hour early so everybody can kind of focus on the Niners game. So just excited about the Niners, excited what's going on with the community, and just excited to talk more health as this year in 2022, we're going to continue to focus on Black and Brown health as well as Black and Brown wealth as we continue to bring financial literacy and these health conversations to this platform. So with that being said, we're going to go ahead and talk about a couple of community announcements, some of the things that's going on in the news, and get into today's conversation. Parents in Iowa are suing the school over a video that shows some white students pretending to execute another student wearing blackface. A number of parents have came together suing the school in Iowa for virtual social media posts that went out to white students, with one with blackface pretending to do a hate crime to some other students. It's been on TikTok. Pleasant Valley High School lawsuit is up. Community is starting to get involved with it. It's just sad that these type of incidents are still happening in our schools, and some folks still think that this is okay. So we want to continue to watch out for that story as it unfolds, but it's just sad to see our young folks still doesn't understand the damage and trauma that those cause when we do these type of things. And nice to see parents sticking together and doing something to hold them responsible. Also, there's been a lack of Medicare coverage for at-home COVID tests. It is starting a big outcry from community folks requiring the Biden administration to do more. They said there was a number of groups who were left out of the 64 million test kits that were going out. And I think they're trying to send letters to the White House to get them to review those, because the number of people with disabilities, people who have medical issues, and different things of that nature were not a part of the bill, and the Medicare insurance for those folks are being impacted. So our disabled Americans that wasn't included in there has just really started a firestorm, and they are sending complaints to them because the cost for these kits is very, very expensive, and folks are trying to get them in their home. So we'll continue to see what takes place with that. But the letters are going out to the White House, and hopefully these folks who are struggling with medical insurance will be able to get some coverage and some help as well. For the community announcements, as you all know, both sides of the conversation and Amazon. If you have an Amazon Smile account, you could support both sides of the conversation through one of the charitable organizations, and no extra cost to you for your purchases. But whenever you purchase something on Amazon, be able to give some support to both sides of the conversation. Our Giving Tuesday pledge is continuing through February. You could go and look at the information to be on our social media handles. If you'd like to support both sides of the conversation, we'll continue to put that information out. And thanks for all of the support and all the donors who've been helping us out. It takes a village. It takes us all to make impact. And we thank everyone who's been continuing to support us. Some of the announcements that's going on, we're going to have some virtual events that are taking place. The Hoop Talk, this virtual Arthur event is going to be happening on Monday, January 31st from 6 p.m. to 7 p.m. 7:30 p.m. We'll put the Zoom link up there. They're going to be talking sports and a number of other things that impact our community. So we'll be putting that information up there as well with the links. The East Oakland and both sides of the conversation, we're going to be working together with a number of other community partners for the Feed the Hood 20 that is taking place February 12th from 9 a.m. to 12 p.m. It's going to be at the East Oakland office collect at 7800 MacArthur Boulevard. We'll be out there for that event to come impact our community, our unhoused folks with food, clothes, and different things of that nature. So we'll be going to a number of campings throughout the communities to help impact our folks. Also, both sides of the conversation, our East Oakland Collective, we are presenting our Both Sides of the Bay Family Bowling Day that is taking place February 19th from 2 p.m. to 5 p.m. at SeaBowl. Please, it's an RSVP event. You have to sign up. It is a free event, but we need everybody to register. If you want to come out and be a part of this event, it's going to be great. Family's going to be out there. We're going to be having a great time bowling and just join each other in community. Also, the African American Heritage Night is taking place this Thursday, Warriors vs. King at the Chase Center. We got information for tickets. If you'd like to get some tickets for $65 to $75 for this event, it's going to be great. It's opening up the African American Heritage Nights. Should be a great game. You can reach out to us at events@bsotc.org if you would like to get tickets for this event. We know the price to get in that stadium is very, very expensive. So what a way if you haven't got a chance to see the new stadium, come out this Thursday night, support the African American Heritage Night. Rafiki Coalition to be out there, SF Black Wall Street, East Oakland Collective. There's a number of phenomenal organizations that's going to be out there to support our heritage and also enjoy a great game. So we're looking forward to seeing you all at that event. The Black Art Society is doing the Black History Month celebration for the arts, February 1st through the 28th at 461 9th Street in Oakland. Please go out there, check out some of the exhibits, see what they're doing. This Black History Month, there's a number of organizations that are going to be doing stuff to help impact the community. So we are looking forward to that as well. A new STEM hub is opening up for children and youth and Community Resource Center hitting the block of 5813 Mission Street. I know some of our folks in the OMI is going to be a part of that. Maurice Rivers and a number of folks are doing things to impact our young folks, and we are happy to see more STEM as we encourage our young folks to find new gateways and new opportunities and pathways when it comes to STEM. So just happy to see that. Also, District 7 and 11 are joining for a Talent OMI Artist Day, which is going to be taking place on the 30th. And it's just going to be a great event. There's going to be a lot of stuff happening at 1507 Ocean Street. And thanks to the whole OMI family and all of the folks that are doing the work over there in OMI and bringing everybody together. Our next show will be Tuesday as we have another Hidden Gem segment on Tuesday. And we're going to have a financial literacy educational presentation next Thursday. And then the following Sunday for February 20th, we're going to have the Black Panther Party, the Legacy Network come on, Dr. Saturo and them. They're going to have a phenomenal conversation. They're going to be talking about Black history and some of the things that are taking place. So just happy to just get through the month, see a lot of this stuff. Hope community gets out and enjoys some of the festivities and things that are taking place. I think it's going to be great. But for the theme for today is Ask Your Black Doctor, the COVID update. This COVID-19 has brought social and racial injustice and inequities to the forefront of public health. It has been highlighted as the health equity is still not a reality during this COVID-19. There's a number of things still impacting the Black and brown community, and it's a lot of work that still needs to be done to help build that trust and that health information to our community. So we are excited to have today's conversation. We know some people have had negative experiences and some folks have been through different things trying to get through this process of vaccination and boosters and things of that nature. So hopefully with some of the questions and comments from today will be helpful. We're going to continue to try to break these barriers down and continue to bring this information and awareness to the community. So today we have two phenomenal folks here. Y'all saw Dr. Mo on Thursday, gave some great information, lift the spirits of the community when we're talking about COVID. And also we're going to have Dr. Kim Rhodes on today to talk with community. So with that being said, I'm going to bring up Dr. Mo so she can introduce herself, and then we'll bring up Dr. Kim Rhodes.
Hey, what's up, family? Happy Sunday. So just rooting out for the Niners, and can't wait to get into some football. But first off, want to have you meet one of my phenomenal favorites, Dr. Kim Rhodes, who has really been a partner in this work from the beginning of COVID. She kind of roped me into it, I will say. I'm deeply grateful for her and always following her around to see what we can do to support. And she is really just inspirational and a blessing to the community. So really honored, Dr. K, to be here with you today. We want to talk about COVID stuff. Dr. K is really for my bang for my buck, she's the best one to talk about COVID. She gives all the best data and the realest talk. And so I really appreciate that. And then also want to get into some conversations about general health, and then getting your checkups and doing all that stuff, and when that's safe to do that. And then also talk about some mental health and some, unfortunately, substance abuse. We've been seeing it in the media, unfortunately, with Regina King's son, with really shocking suicide. And that's just one of, unfortunately, hundreds of suicides of our community members. So want to get into some of that and talk about what to look for with that if you're worried about a family member or yourself even. So I'm going to kick it back to John Henry to welcome Dr. Rhodes.
Man, well, we're just excited to have Dr. Rose here, a phenomenal queen doing some amazing thing to impact our community. I told her today, nice to finally meet her. She's a mover and shaker. I hear her name in a lot of these conversations, and just nice to have her here in a community. Here's the time to ask your questions. I know we have difficulties finding folks who look like us in that medical room to ask those questions. And before you go to your next appointment, we're just honored to have her here today and take some community questions. So with that being said, Dr. Kim Rose, let the community know who you are and all the amazing things that you are doing to impact our folks.
Thank you so much for the invitation. And Dr. Mo and I have been through some stuff as far as COVID goes. But it's really important to me and in my career to always have engagement directly with the community. And there are ways in which sometimes from academia, we cannot reach community. And so it's been an amazing partnership. I sort of joke that Dr. Mo is Malcolm X and I'm the Martin Luther King, and we're actually working together. So so I am, just by way of background, I'm formally trained as a colorectal surgeon. So I used to take care of colorectal cancer and other intestinal problems by surgical means. But I've always been committed to working in community. I trained as a community organizer at the Center for Third World Organizing in Oakland back in the 90s. And I really committed myself when I started medical school that I would be there to learn all the secrets, and then I would come back and tell the secrets to the community, because I know there are ways in which our systems close the door, look for secret language, have secret agreements that we don't know about. So I am 100% committed to community. So it's not so much, I think it's important that I look how I look, but I think more importantly, I think about the world in the same ways as people who look like me. And what we all have in common is how we are treated, how we are valued or not valued. And so I'm always looking very carefully at whatever data is being presented or whatever is being offered to us to make sure that it's filtered through a lens that combines a knowledge of the Black experience in America with the scientific background. So just to finish situating, my academic credibility, I will just also say I've spent a lot of time looking at data for the whole state of California, asking the question about whether or not differences in the quality of care accounts for disparities in cancer. And we have found that it does, and I can talk about that. I've also got a background in basic science, and I was very active in the laboratory during the HIV epidemic, cloning and sequencing what we now call variants. Back then, we didn't call them variants, but looking at mutations in HIV that made it stronger and better able to infect people and escape treatments. So for whatever reason, the pandemic seems to be bringing together pretty much all of my background and expertise and training. So I feel like I'm in the right place at the right time as far as having started Emoji Health, which really was birthed out of a partnership that started with Dr. Mo.
Wow, phenomenal stuff. You sound more like Harriet Tubman, freeing the people.
She is. Don't get it twisted. I was wondering too, Dr. Kim, could you talk about Emoji Health a little bit?
Sure. So Emoji Health, well, first of all, Emoja in Swahili means unity. Most people probably already know that. And it was a name that was chosen as a play on the United in Health efforts that started in the mission. And after the mass testing in the mission, UCSF decided to go to Bayview, Hunters Point. And I was, of course, afraid because in my day job as the Associate Director for Community Engagement for the Cancer Center, I was already working with Dr. Mo on some other projects. And I was concerned about preserving the relationships that we had created. I didn't want to have some disruption based on the perceptions of partnership that sometimes come from institutions to community. And so luckily, the chancellor asked me to lead that initiative. And so it made perfect sense to work together with Dr. Mo. And we did the mass testing when testing was not available back in May and June of 2020. Was not widely available. We did no barrier testing. We tested everyone who showed up. But what we found was that the African-American community did not show up in the numbers that we would have liked to have seen. But several weeks later, we were contacted by some of the partners in Sunnydale, Drew Jenkins and J&J Community Resource Center, Mercy Housing, and they asked us to come back and do more testing, which really, I think, spoke to the feeling that they had about what we were able to bring to the table. So we did the first pop-up COVID services anywhere in the Bay Area. That was, I believe, June 27th, 2020 at Family Day. And what we saw by popping up on the street on Sunnydale Ave was that more African-American people came out because the people who were asking them to come out were their neighbors. And I think we took a big lesson from that as we moved across the Bay into Oakland, which was also by request, where the community chose the name Umoja Health as a play on United in Health. And what we decided there was we can't do mass testing because we saw that it doesn't draw the numbers and the representation of the communities that we would do it in. So we needed to go smaller and be in neighborhood. So what we've done is use data from the public health departments to direct and drive how we provide service. And then we partner with credible messengers. In Oakland, it was the Oakland Frontline Healers, the Brotherhood of Elders Network, and others to select the locations. And so we tested in places you would never expect to see testing, next to the liquor store, in the parking lot at the liquor store, right? And what we effectively were saying is, we're here for you, however you want it delivered, we're gonna try to tailor it. And that allowed us to really reach and to raise attention to the fact that public health doesn't necessarily break down like what is your percent service to the African American community. So I think we were the first to really start saying every week we're going to look at that number, and we want to see overrepresentation. We want to see that our people are being overserved for once, because it's so rare that that happens. And what we were able to achieve was that our service went 60% to the African American community, which is more than triple the representation in Oakland. And that prompted the Alameda County Public Health Department to give us our own allocation of vaccine, because they knew that we could reach people that they weren't able to reach. And then once that idea and concept caught on of the weekly meeting, the service for us, by us, in community with volunteers, not just a bunch of doctors together, but actually everybody, all hands on deck in this emergency. The concept spread to San Mateo County. So then now there's an Emoji Health San Mateo County, North County and South County. And then we came back to San Francisco because some of our partners from the initial efforts were not getting vaccine at the beginning of the vaccine rollout. So we engaged the public health department and basically started pointing out inequity and discrepancies in the distribution of resources. And so they got on board, and now we've got 4 different Emoji meetings that happen every week, keeping the community informed and trying to provide service.
Wow, that is
and
phenomenal.
keeping Dr. Rhodes really busy.
Well, I mean, I'm
like she
happy
said,
that-
her day job. She's got a whole other job.
No, but we happy that you know, that you're doing that, and I'm glad when you talk about credible messengers. You know, I was on a couple of calls and I really was a little frustrated because, you know, I know that there's in our community a great push to see people who look like us to talk to us, to get us to move when it comes to these type of decisions when we're talking about our health. But I also think that, you know, the messaging wasn't as clear as it was, and I don't think it was so much about having Black providers versus white providers. But what we found was a lot of people use that as an excuse not to give messaging to the community. So, you know, and it was saying, oh, well, we wanted to make sure that we have Black providers or nurses to educate community about it. And I think they did a disservice. They had missed the community because a lot of people were holding back to really be transparent and give information to the community. And I was like, hey, at the end of the day, we're in a crisis. Give us the right messaging. I think people step up. I think the medical side of it, because so much was transpiring and changing, that we didn't really get a focus on what was going on. I think once we didn't really have something, you know, substance to stand on, people were kind of just back and forth, and we was losing message because things were changing at the CDC. But just great to have you all out there to change those folks, to get them to move, because we was in some dark time where people weren't going to get tested, wasn't getting vaccinated. And, you know, thanks to Emoji and Rafiki Coalition for all the work you all been doing to make sure that our folks get access to those services.
Yeah. Our pleasure. And I think the filter, the message for us, because, you know, just because it's in English, it doesn't mean it's for us. And I think it's much easier for healthcare and public health to see, well, if we translate it, then that means that we've done it for, you know, fill in the blank community. But we get it in English, and so we don't get the cultural tailoring, the kinds of concerns that we might have being addressed. And so that's a big part of why we've held together this long, and why the frequency, and why we have such frequent meetings, right? The information is changing quickly. The CDC at this point kind of feels like, you know, do choose your own adventure. You can stay home for 5 days, or you can stay home for 10. You can test, not test. You can, you know, they say you have to wear a mask as if mask wearing isn't already a priority. So we try to filter all that information and try to make sense of it, and even question it when it's not maybe the right messaging or something that's going to be beneficial to our community.
Yeah, very, very important stuff. And, you know, I want to ask you, Dr. Rose, because you, you know, at UCF doing Emoji, really tied in, you had that background. You know, how much is the healthcare system actually taking what's taking place and actually utilizing this to kind of move that barrier between the Black and brown community, because I think we learned a lot, from this COVID. As you said, COVID has opened up the doors to find really the real health disparities and some of the things that's impacting our community. But I also think that this is a great time that we do go after these health systems and really try to break down some of the systemic issues that have been taking place. Because, when COVID kicked out, a lot of people were, originally saying, oh, it's just Black folks getting it. But we didn't really address, some of the underlying health issues when they was explaining COVID in that process of transformation or getting it, not really understanding to the mass people saying, hey, this is why the African-American population is tested at a higher rate positive than other because of these other health issues with asthma and, high blood pressure and things of that nature. How do we, take these lessons, these learned lessons, and in the system of our health care, try to make that change and pivot to really get these folks to focus on some of the main issues that's impacting our community?
Yeah, I think that's the $1 million question, because, now we've been in this for 2 years, going into year 3, and it's unclear what changes have been made. And what you can hear in the rhetoric around COVID is when we get back to normal. And I know a lot of us who sit on the short end of the stick in normal are like, I don't think we want to go back. That's how we got here. So the question is, what are the innovative ways to shift what we do so that when the next pandemic comes, it doesn't look so starkly disproportionately impacting of people who don't have resources or who are, structurally discriminated against in our country. I don't see the healthcare systems moving yet. I hear a call for hospitals and doctors' offices to become more involved in the public health effort. And what I think that just points out is the division between healthcare and public health, which happened a long time ago, because healthcare wanted, I can treat you with one, I can get diagnose your disease, give you a medication, and cure you. That was much more exciting than I can change the sewage and water system in your town to prevent the spread of cholera to every household, right? So it's just that takes more work and more investment. And so they've been split apart. And then one generates revenue, that's healthcare. And then one doesn't generate revenue, that's public health. And so what we're seeing now is healthcare actually needs public health to save it from the hospitals collapsing. But despite that, healthcare has been very slow to say, how can we engage meaningfully with public health in order to save ourselves? I think UCSF has done a good job of engaging in the conversation in a very deep way and making investments. So Emoji Health started on the back of investment directly from the chancellor, a commitment to addressing the issue in community. But now that we're at this end of the second year and going into year 3, the question is now, how do we integrate something that goes on in a transformational way as we emerge into, I guess I'll call it the new normal? I think that healthcare is still clinging to the idea that we're going to go back to the old normal. And I feel like COVID, every time we start getting ready to go back to the old normal, COVID brings a new surprise to slap us back to say, no, we need to innovate now. We need to work together. And part of what Emoji Health I describe is, we often talk about from academia, we need to build a bridge to the community. And you can hear the sarcasm in my voice, because what I want to say is, you only need a bridge if there's a gap.
Right.
Emoji Health exists in the gap, combining public health and connecting it to healthcare. So if there's no gap, you don't need a bridge. And so where we need to be working in this transformational time is in that gap. That means public health and healthcare together.
Well, I want to say this because, you said something that's very touching to me. There's a lot of people saying we have to meet our people where they at. But we're finding a lot of these folks don't want to meet people where they at. I'm telling these people, hey, you can't call them down to your location. They might not make it up to UCSF, but how do we get these resources knocking on the doors in our community, up on that hill in Sunnydale, where a lot of times these folks don't want to go? And I mean, I think that is the real power of
Mhm.
Emoji Health and Rafiki Coalition, being able to have
Mhm.
those community connections where you can set up on 90 Kiska Road and you can set up on
Right.
Oakdale
Mhm.
and get the community in there to do it. But there's a long way of what we need. And I think, together as a health community, it's going to take a lot, because I really got to give UCSF their props for and shout out to the Chancellor Hallgood. Sam's been doing a lot of stuff to promote that. But we found
Mhm.
a lot of the health providers were very distant when it came to
Mm-hmm.
the Black community, and I got to give UCSF their credit. They really worked with BHI and a number of the community organizations to make sure that we got the testing and some of the things in the community, where there was a lot of organizations that was kind of just, where did they go? And as things picked up, they wanted to get
Mhm.
involved, but they didn't. So definitely want to give UCSF their kudos for that, because I did see a
Mhm.
lot of setup from UCF pushing in the community and making
Absolutely.
that work happen. But before I
A
pass it to
lot
you,
of a lot of
Jay,
oh, John Henry, I was gonna say just to this point, and this is not to put anybody on blast, but a lot of the other hospitals, including Kaiser and other folks like that, were not around. We could not find them. They didn't want to see us. They didn't want to give us any of our regular exams. Basically, the email I got from them
Mm-hmm.
is stay home and don't come over here.
Mm-hmm.
And so, in that sense, really, we really, really want to make sure that we're giving props to UCSF, and that work is Kim, right? That work is Kim, especially in the Dr. Kim in the Black community, because in the Latinx community, a lot of folks, the United Unidos en Salud came out because they were seeing a lot of the infections first off, and then also because they were able to mobilize with some of the docs who they were actually related to. So it's a very different conversation that Dr. Rhodes, and this is not to pit Black and Brown against each other. This is just to say that we're positioned very differently in San
Mm-hmm.
Francisco, and there's a lot of different politics. So I just really want to give Dr. Rhodes those props, because she was the one that knocked down those doors, and UCSF heard, saw, and followed, and the chancellor and everybody else. But if we hadn't had her in there doing that, I don't know what that would have looked like. And frankly, also, I want to really give big props up to Supervisor Shaman Walton, who
Mm-hmm.
was really pushing with the media. Joy Jackson Morgan, I saw you in the chat. Joy, people talking on the press conferences. Our folks really came out, Dr. Director Davis, who really showed up and showed out in the early days with COVID. So we had a lot of folks in our community who really, really stepped up, and that was huge. And so I just want to say shout out to that, because then from there, when we have that, then we get to keep it rolling. But if we hadn't had folks like arm wrestling the door open, you know,
yeah,
I don't think we would have been able to be, in terms of Rafiki and the work with in 94124, and with all the work of all of our partners, we wouldn't be able to do what we did if we hadn't had all of this beautiful opening to the beginning. So we got to just say, big props to that. So I didn't want to interrupt you, but I didn't want to leave that one hanging, because later Kaiser came out and was like, "Oh yeah, we want to support, we want to help," and they got new people in different key positions, and now they're on it. But it wasn't that way from the beginning.
yeah, very phenomenal stuff. And I was out doing some of the coverage and outreach too. But one of the things, and I don't know where we at, and you probably have this answer, Dr. Rose. A lot of folks that were going to get tested in the community at the Baby Opera House. One of the concerns that folks were having was, if they did test positive, the
Mm-hmm.
staffing that was there would say, hey, you have to reach out to your primary care provider. But what we found was there was a number of folks from the community that didn't have that,
Mm-hmm.
primary care
Hmm.
function, right?
The
So they
link.
was like, what
Hmm.
do I do? I don't have a doctor. I don't have insurance.
Hmm.
Mm-hmm.
Um, you know, in those
Hmm.
instances, right? And we know this healthcare shortage and the access to medical services is so, we deal with the highest disparities in our community. But how do we help those folks? And that's why I was asking some of the staff, okay, if this person doesn't have a primary care doctor, what is the community organizations and the healthcare care
Hmm.
system? Because this is a crisis, how do we help those folks? Because they're going to just keep walking around and they don't have a provider, so they're not going to get that extra
Yeah.
information, or
Mm-hmm.
just don't
Yeah.
have the funds to go and take care of themselves, whatever medical needs that they need. But how do we fix that, or how do we engage to get that support as well in this work of during COVID?
Yeah, and I think that's another place where the coalition building comes
Mm-hmm.
together, because you can't do it just as one organization, seeing folks who have needs. They can service maybe one need, but if you're in coalition and partnership, everybody's bringing something to the table. We call it stone soup for Emoja. It's like whatever you can bring, yeah, we want it. If you're bringing HIV testing, which we partnered up with CalPEP for that. If you're bringing flu shots, like, we will host you. We'll put you up a tent and you come to our location. The other thing that we tried to do is have a what we call the social services pavilion. And so we would have the general services agency, for example, equivalent in the social services agency in Alameda County would sit on site. Lifelong Medical, Roots Clinic, some of the local community health centers could hook people into care or link them to either open enrollment and helping them get signed up for insurance, or just helping to link them to primary care providers, which we couldn't, do on our own. And then the other piece of that, is this question about who can afford to stay home, who has the privilege to be able to work from home versus who needs to work. Otherwise, they won't be able to put food on the table. And out of the United in Health efforts, the community wellness team concept emerged. And so for people who tested in the United in Health type settings, which then was adapted actually by San Francisco Public Health Department,
and by us.
Yeah. Exactly. And through the contracts through the public health department and other people coming together, there's an opportunity to deliver groceries to people while they were in their isolation period, and do wellness checks with them while they were isolating, so can answer any clinical questions, make a determination if someone needed to go to the emergency room, because obviously we want to keep people out of the emergency room if you don't need to be there right now. And again, this gets back to your question about what is it going to look like as we move forward and how to step it up. Like, these large coalitions working together is the way to link people into care and not go back to normal, where people don't have a primary care provider. During COVID, some community-based organization was able to provide all of these social services and resources that I'm talking about. Question is, how do we cement that into what is normal?
Yes.
Right? That's what needs to be normalized.
Yes.
Wow, that's definitely great
And
information.
also,
go ahead, Dr.
Oh, sorry, John Henry. I was just going to say at our testing and vac site specifically, we do ask if someone has a regular home setting, and if they do want to get supported with getting signed up, we will get them through warm handover to someone who can get them set up with a doctor, a home-based doctor, because it's so important. And that's the same case with all the positives as well that get called. So that at least that's the hope. That's the plan. I don't know what happens across the city, but that is the plan. And that's what we're offering through the 94124. So if anybody doesn't or hasn't gotten something like that, please do reach out to me. I always want to improve, and we want to make sure that we're getting every person what they need, because there's just, the needs are endless. And I think that Dr. Rhodes and I have talked about this for such a long time, and I just want to mention it, that our work together was around environmental justice initially. We wanted to look at cancer. We were looking at breast cancer, specifically in Black women. And we were also looking at how do we make the changes that are prevention versus coming back later, when people are dealing with, a significant diagnosis. So we have all the environmental issues that we have in Bayview Hunters Point, from the shipyards, around, all of those things that we haven't even gotten to get into lately, Kim. And so,
Well,
2 years on the burner.
It is still ongoing. It's a little, it is still ongoing. We continue to try to figure out the best ways to understand, because the challenge that comes when the community gets involved in environmental justice is the scientists say, well, you can't really document an accurate exposure history. So maybe you weren't exposed long enough for this to be the cause of the cancer. And so in the same way with Emoja, taking a different approach to the questions, we say, well, maybe you're looking at the wrong cancers. Maybe we should be looking at cancers that are radiation sensitive, or that are driven by, known to be driven by radiation and other types of pollution. So for example, all the asbestos. Why aren't we looking at mesothelioma instead of looking at regular lung cancer and then blaming Black men for smoking too much, right? We're not asking the right questions. So we're still in the background. We're still crafting some of that, and have had a chance to put together some very interesting information about how we collect residential history, which is how we get to exposure. So hopefully you'll see a little town hall on that once we have the little pilot data written up to share, because we do have some important points, and we will be making them to the National Cancer Institute.
Wow.
And it's so important to really do this local work. So I wanted to mention that, John Henry. And then the last thing, and then I'll shut up and kick it back to you, is this piece around looking at the longevity of the lifespan and what someone has been exposed to, and what can we do preventively. So how does science, community, and wellness and prevention all work together in this public health piece that Dr. Kim was really speaking to? Because that's really what we need to do. If we don't do that, then we're going to keep seeing these disparities, and it won't matter. We'll have, pandemic after pandemic, but we're going to be, we're literally getting years shaved off of our lives. And a lot of that is about, and this is my big point, structural racism. The structural racism, the geographic isolation of Bayview Hunters Point. Now, I'm just seeing that supervisor, now president of the Board of Supervisors, Jamon Walton, and through his office, is just saying that at our little Bayview Plaza, we're going to have a Lucky's. We haven't had a full service grocery store in D10 in over 15 years, I believe. And so we will, these are the types of changes that we have to see, because, food justice, health justice, prevention work, all of these things, transportation, jobs, education, they all have to go together. They're not in isolation. They're all connected. So I just wanted to make that point.
And they enhance each other, right? I mean, if you can get access to healthy food, you can think about a future with lower rates of diabetes, right? I mean, you can't think about that when what you've got in your neighborhood is a bodega selling you carbs, salted and fried, right? Chips and whatnot,
and sugared,
right? And sugared, but it's really where it's hidden. The sugar is obvious, the candy is obvious. Where it's hidden is in the chips, right? And the bread. It's those carbs that people don't recognize as kind of traditional, diabetogenic, drivers of diabetes in the future. But if you have a healthier populace, you have people who are able-bodied and can work. And they do go together, but they also enhance each other. And I think you can't have, without community health, everything else sort of falls apart.
Wow, that's great information. I just want to say thank you for advocating for the community. That's what we're lacking, and that's what we're trying to do here, just to bring that level of information and education to our community. And when you talk about food deserts, that is impacting all of our Black and brown communities across not only San Francisco, but throughout this country. And, really trying to come up this new year, we've been talking about 2022, bringing everything new, bringing new excitement, new relationships, new everything for 2022. We want to change that paradigm of our community. But when we talk about food, I really would like to see more of our Black nutritionists and some of the folks who are in the nutritionist business to really educate our community how to utilize the resources that we do have to produce healthy meals for our community, because too many times our young folks just want fast food. And I'm almost at a point where I was telling Shema, we got to ban how many McDonald's we have in our community, how many liquor stores we have in our community, because those are some of the problems that we have to combat, and I understand the money part of these franchises buying in the community, but you go to other parts of the city and you don't see a McDonald's every 3 blocks, or you don't see a Burger King every 3 blocks. But I think it's just that education. I mean, we've lost a lot of it. I know the pandemic has really, as people are in the house, brought to the forefront, how much more training we need for our young folks, as well as some of the folks in the community, just to start cooking, taking out recipes and doing some of the things that we used to do. But I would like to see more of that, and we're open to that this year. because I think that's where it all starts, having these cooking classes, bringing some of that traditional stuff, as we call it traditional here in America, back to the forefront. I think we've already been at Z, and I'm happy Dr. Mo said it. We have been so reactionary in the Black community. And I think we just need to spin it all around and just start back at the basic, take a full reset, and let's just start back at the basics and teaching our young folks and teaching our community folks the basic things to be successful, the basic things to be healthy. And I think that's where we need to be headed. And Dr. Mo was talking about the packaging and the stuff that they were doing. My daughter, when she had tested for COVID, bringing the food to the house and just having the information there. So I wanted to thank Rafiki Coalition for that as well, because not only did they drop off the food and the resources, but they put the information there, added PPE kits. It gave you a time, because if you were isolated, a lot of people wasn't watching TV in our community. A lot of people wasn't getting the news because of those financial inequities that we face with. So people were just listening to family members and different folks. And that's why I say, all of these platforms, all these folks that are doing things to do outreach, it is so important, because there's so many of our folks that are impacted, that don't have the connections or don't get access to the information. It tremendously hurts our community. But, we're going to continue to push to do our part and get that information out there. And it's just nice to see both of you advocating and fighting in those spaces, because a lot of times these decisions are being made by people who are not from the community and don't know. And it's always great to have you all, as well as we'll do our part to continue to fight for our community.
We will. We will.
No doubt.
I wanted to just say real quick, I don't know if there's any actual medical or, questions, things like that. I'm seeing this piece around the fast food and banning that, so absolutely we need that. And one of the things that I was going to ask is diabetogenic. Is that a word, Dr. K?
Yeah, it is.
Okay, so I want to know about diabetogenic. Like, that needs to be a word. It needs to be a rap song. Like, what the heck is, like, how do we do that? Like, well, that's diabetogenic. It's like, we gotta see. I want to see how we could, play with some things so that we can get these concepts out there, because I've never heard that word before. And I'm a pretty well educated person. And so, I think just kind of getting, I think that the difference, even for those of us who grew up, I'm a 70s baby. So, I grew up with a working mom, so, she tried her best to, we had a lot of frozen vegetables. When I lived with my grandparents, we always had salad with our food every day, and they would cook fresh stuff. But when I was living with my mom as a single mom, Pop-Tarts, SpaghettiOs, all the comfort stuff, right? Mac and cheese in a box, Steakums, if you remember all that stuff. I don't know if you remember Steakums.
Yeah. Yep.
But all that stuff that we knew how to cook ourselves because we were kids, right? And so just kind of recognizing that how, like, the difference is that comforts something in my brain, because there's an addiction to sugar, right? And all of that turns into sugar in our body. And so through that addiction to sugar, it feels good. But there's a, somehow psychologically, but there's a difference between what healthy, fresh vegetables feel like in your body, than what that feels like. And eating something green, or, having a juicy mango, or a banana that is just like, fresh, like, or a crisp apple. Those are things like, apple, we did used to have things like also snacks, like peanut butter and celery and, things like that, I don't even see people eating anymore, so there are some things that I do know a little bit from my childhood that are about health, but I have to kind of go back to my grandparents' folk age range to get the really healthy stuff, because my mom had to do what she had to do as a single, working mom. And I don't blame her for that. But my nutrition, it's impacted my body, my whole life, based upon that's how I grew up. And those are the tastes that I grew up with. But, kind of retraining myself to eat fresh, healthy things is a very different conversation. So I would love some of that conversation, for us to keep having those conversations. Because you can make gumbo that's like with all the fresh vegetables and all the fresh meats and the rice, and it tastes so different than if it's out of a can, right? So that, we can make things healthy and still be traditional foods.
Well, I think that gets
I know
back
I've been
to
on about gumbo.
that that gets back to the question about access, right? And as this Lucky's opens, I think about and I just want to say I grew up with canned vegetables. I think I didn't eat broccoli until I was in college, maybe. I had never been served broccoli at my house. But the issue is access. And I think back to there was a big study in Boston by Ochiro Kwachi at Harvard's like social science and medicine, like that's his thing. And what they did was they grocery shopped in a chain grocery store in different neighborhoods. And in the wealthy neighborhood, they bought the same items and then they compared the receipts. And so once this Lucky's opens up, I think we ought to do this because what they found was that fresh fruits and vegetables were more expensive in certain parts of town, which is where the Black American folks and low resource communities were living, versus in the wealthier parts of town, even though it was the same chain. And I think we need to keep our eyes on that because that is, I don't know what I think the benefit to the store owner is about, I'm buying all this fruits and vegetables that may not be being consumed. I have to throw them away. So I'm covering my costs by charging more. But I think we have to pay attention to those kinds of things because that is more structural racism and structural discrimination, and it can happen. So we can eat better. Yes, it's better for our bodies, but if we don't have access, if we don't have real access, then it's not going to really take effect and have the impact that we know that it could have.
Yes. It's a big concern of mine, especially with inflation going up. I just left the grocery store today, and I swear I go $300-400 for what? So I can only imagine for our folks who are financially impacted, it's going to be a challenge in this upcoming months to help our communities. And that's why it's great that we have these different community organizations out doing the work, bringing groceries and helping our families out to get some of that healthy food. East Oakland Collective is doing a phenomenal job of getting that out to the community. We got a number of other organizations around the Bay Area that are trying to help out our seniors and help out some of these families during this time of COVID, especially if people are in the house. The amount of cost, the days of work that people are losing is just, it's very impactful to the community. And, I just want to keep putting that out there that we're going to have to do more. And we got to figure out some real strategic ways. Yeah. But what Lucky's coming to the community, it's a great victory. But I want to see how it definitely plays out when we talk about the amount of service and the quality of food that they bring to the community. So we definitely be watching out for that.
All that.
We can integrate that.
We got to partner with them.
That's right. I was going to say, and integrate the part of what Emoja is doing is we're not an organization. We don't have 501c3 status. We don't want to compete with other 501c3s who are already trying to get the money. Instead, we're trying to amplify community voices and hold institutions accountable, basically having them answer questions directly to the community. So imagine we have like a food corner as what we like to say as COVID becomes a side dish and we can get back to thinking about cancer screening and diabetes control and hypertension management. We should have a food corner and say, like, how's the Lucky's doing in Bayview? Right? Are we getting good service? Do we have selection there? And I do want to do the price comparison shopping, even if it's just me going and price comparison shopping and those receipts upon us, because that putting the truth out in front, I think, is the way that we've been able to get public health in San Mateo, San Francisco, and Alameda County to start to come to our table and want to be in our meeting to hear what the community is saying, and then also to try to be responsive. So we should integrate the food conversation into that.
I would definitely love to do that, as well as how do we organize? Because you brought up a big question that I'm still everyday processing. When we talk about holding people accountable, what does that look like for our community, and how do we figure out a way to really maneuver our call to action where it's actually something that's sustainable and we can tangibly see it in our community? Because I think we have a lot of people screaming about what the problem is, and these things are continuing to happen. But I want to figure out, how do we start moving our people? When we're talking about a call to action, how do we get people to show up? How do we get people to sign petitions? How do we get people to march down to our elected official doors and beat on them doors and ask for what we need? Because I think we have a lot of people screaming about what the problem is, but we don't have the real answers of how do we move people, and how do we really get those results that we want when we put these elected officials in place? We've seen it throughout this country, nationally and locally. How do we hold these folks when they get into office? They promise the Black community all of these things, but when they get into office, sometimes those deliverables are not there, and that's really what my focus is. How do we get our community back together, moving forward as one?
Absolutely. Well, one of the things, I know Dr. K probably has something to say about this too, but I think one of the things that we have to recognize is, like, if we look at the Asian community, API community, if you see any issue that is impacting them, they literally will bring buses of people up to City Hall to testify at public hearings. And for us, number one, we end up getting kicked out half the time of these public hearings. So there's something that to be said about how we get treated when we show up. And I mean, maybe we need to go back to the Panther days of, this is what you do, this is how you act, and this is how you do it, so that you can get your voices heard, we can get our voices heard. But the other piece about it is the trauma of being listened to, not listened to, ignored, and policed and criminalized for such a long time, is that when we get up in front of these things, sometimes we're so mad, so angry, so hurt, that and the depression and the angst, and the anxiety that comes, and the PTSD with all of these things that folks have had to deal with for such a long time, is that you just want to holler and scream because that's what you got left. But we can't do that. I mean, we can, but we need to do it with strategy, instead of being reactive. And unfortunately, we've been so pressed to being so reactive because survival for us has been a question. I mean, is a question mark every day. I mean, you think about this: $300 or $400 at the grocery store, John Henry. $300 or $400 at the grocery store for a week.
And I didn't
groceries,
even get anything.
Like, what happened?
I didn't even know what I bought. I go, what did I buy? There's nothing in here, But yeah, it's a challenge.
There's nothing to eat. You go to the grocery store, there's nothing to eat. But this is the thing, right? And so that's ridiculous. I mean, we had a gift of a donor for food, and I think Amazon is actually going to come in and help us with our hot meal program. But I'm still looking for another donor for the food boxes, because what we were able to do with the food boxes is give all of that organic, healthy food that we can't do right now. And that's not what you're finding at Marin Food Bank, And so we need all of our folks to actually make that call to, to the supervisor's office or email and say, hey, I don't want SF Food Bank food. I want healthy food. I deserve healthy food. But I can't pay $300, $400 a week for groceries. So this is my right. This is my reparations. How do I get it? But we have to relearn that conversation from the 60s.
Wow, yeah, that's very important. And Dr. Rose, I want to ask one thing, and I know Dr. Mo heard it when I asked the other doctors, because earlier you talked about the cancer in the community and some of those things that are impacting our community. I've been trying to ask this, and maybe you can help us with the emoji or something. How do we create a checklist for our people? Because I've heard different doctors come on here and say, even during COVID, because we don't have a lot of people advocating for our folks, and sometimes our folks get intimidated when they go into these doctor offices. But how do we put together some checklist for our community, for males and females, to say, hey, when you go to your doctor, ask these things, or when we do blood tests, check for these. How do we get those into some kind of form or document, and that we could get out to the community, especially because we had a conversation this past October with a couple of folks on here about breast cancer during Breast Cancer Awareness Month. And one of the things that they were saying, the pop-ups wasn't happening. They used to bring mammogram services to the community, to folks, and then it went away. But then they were saying it was things that women could have did at their doctor offices to have them check for certain things during their blood test. But a lot of the folks in the community is like, well, we didn't even know that. So how do we create something like that, like our own Black health card or the Black questionnaire? I mean, I know we have for men, at 40, 50, check for colon cancer. But what about those other things that we miss that sometimes we don't even go when we talk about sickle cell and things of that nature? Those are some things that we don't even ask. So how do we put something like that together, make it tangible, and get that out to the community?
Well, I definitely think that's something that Emoja, the BHI, like other, I guess I can't say other organizations because there aren't that many, but where there are engaged clinical experts who could come in and have that as a project. That's something, if we were, we used to, in between the January 2021 spike and Delta, remember we were in like a little bit of a dip. We had a break. We were like, okay, COVID's going to be the side dish. What are we going to be bringing next? Right. And just as we were kind of getting into that, thinking about that strategy, we got Delta. So we had to turn our attention back. Right. But I think that kind of planning should probably be going on in the same kind of way that Emoja is engaging every week. We're providing some information about, for Emoja, it's always about COVID right now. But imagine a meeting like that, a convening like that, that's about general health and covers general health topics each week. And then we decide at the end of the meeting, the community's like, okay, is this something we want on our kind of health checklist, right? That I think if we develop it in collaboration with community, there'll be way more buy-in to using it. Yes. And the magic of having people on the call, they're not there just representing themselves. They're representing their network of all the people that they know, their neighbors, their family, right? So if we develop that together with community, then we could actually reach more people with it than if we just developed it, inside the institution, said, here's the checklist you should worry about. I think there needs to be some conversation and some engagement of folks in their own process. Like, what do I need and what questions do I need to get answered? And so what we can do on the academic side is be more available. I think we're not as available. I've been saying this now inside UCSF. It's like we're not as visible as we really could be and should be.
Yes.
Because if we get that engagement, that's going to enhance how we deliver care. It's going to deliver on market share, which is really what healthcare kind of cares about. Like, who wants to come to your place are the people that feel like you actually care back. And so I could see that as a collaborative effort to uplift the health of African-American community, to start to convene that conversation and develop that kind of checklist. And then to have attached to that checklist, I have this joke. I used to tell people, just tell the doctor that I'm your cousin Kim. And then you can tell them, I love it, because in the American College of Surgeons, if someone looks you up, the American College of Surgeons tells you someone's been looking. And so I always thought it was funny when I would tell somebody, tell them your cousin Kim, and you can tell them who I am, and they can look it up. And I always say it and weep, because it's hard to shoot holes in it. And if you need me in your appointment, then you're going to put me on mute. I'm going to listen. I will send you text message questions of what to ask your provider. And it really just is a matter of translating. So in conjunction with that engagement directly with the community, we need to also be making ourselves available as advocates, and then also training other community members who can advocate at different levels. So if you need something complicated, you might need an MD. But if it's not as complicated, then we've got advocates and educators in the community who can play that kind of role. And I would love to build that out, because I think that's the new system that's going to be able to hold our people who don't have access, who don't have a primary care doctor. And what people want when regular people talk about access, what they want is an answer right now. Why does my elbow hurt? Right? When we talk about access, we're talking about insurance and can you make an appointment and wait 6 months? And by that time, your elbow doesn't hurt. So what difference does it make? So I feel like we need to get closer to the people, because we are the people. We get taught that we're not, right? And then we hide inside. And especially when it comes to the Black community, I think there's some proximity fear. So I think that closing the gap by being in the gap and functioning in the gap is where we're going to make progress. So that's what I would love to be a part of in terms of creating this checklist. So like a checklist that comes with a consultant.
Yeah, I'm there with you. I want to be a part of it. I think that is great. I think you own to something. That's what we need to do. We did have a doulas and midwife show here a couple of weeks ago. And the biggest comments from the community was, we need people to advocate for us. For whatever reason, the taboo of the health system, the stigma conversation, and the trust issues. Sometimes our folks that get into these situations in their healthcare and they're not being honest because of embarrassment. And sometimes you just need that person to advocate for you. But I think that would definitely be something cool. I'm going to use that. I'll be like, hey, call my cousin Kim. No, yeah,
Well,
I think
we need to train more. We need to train more. And I think this is a place where the medical students could be impacted. I like to say I
Mm-hmm.
was radicalized as a medical student. I think if I hadn't worked with the Bay Area Black Women's Health Project as a medical student, there are things that I would not be sensitive to. There were things that I saw because
Mm-hmm.
they treated me like a part of the health project and not a part of the institution. So I got to hear the
Mm-hmm.
conversation after the meeting with the institutions and like, oh yeah, we worked with them before. Here's what they did to us, right? And the institutions were like completely forgotten, or it's a different investigator. And so I think that we need to get the medical students out of the building and in the community and
Yes.
understanding how people live their lives, how real, regular, normal, everyday folk live their lives, so that when they become more part of the institution, the recommendations that they make, the prescriptions that you're writing, right, will prompt a question. Can you afford this? Like, where's the pharmacy near you? Are you going to be able to get it? Because they've seen it, happening in real time as part of their training. I think that's a big missing piece of what happens in clinical training. And the other part, as far as like trust in our community and trust, I feel like I get asked this question a lot. And I always keep coming back to this one thing. Well, first of all, trust builds at the pace of the relationship. So if you don't have a relationship, you shouldn't expect any trust. I mean, and that's true between you and your friends,
Real talk.
me, right?
Mm-hmm.
But the other part of it is like, there is no magic to what I'm doing. I just actually care. And then I try to
Mm-hmm.
operationalize the fact that I care. And I
That
don't
part.
care in a
Mm-hmm.
way that's like pity. I don't care in a way that's like, I have more than you, and so I'm going to lift you up, because that's actually about
Mm-hmm.
me. It's more just
Mm-hmm.
about really operationalizing, like seeing the vulnerability in myself that I know other humans feel. And when it comes to cancer, I
That's
think about
right.
that all the time. It's like, people don't necessarily want new technology. They want a hand to hold. They want a warm hand. They want to feel cared for. And I can see it when we're on the street in Mendel Plaza. Some of the folks who are coming to get vaccinated will say things like, well, I do dope. And I'm like, yeah, okay. I mean, I understand that's part of your life. I'm not going to lecture you about that right now. I'm not going to try to, force you to do something about it before I vaccinate you. I'm not going to judge you. We're just here to try, like, we know our mission is around COVID. We're trying to save you from dying from COVID. And so we're
Mm-hmm.
going to do that. But the fact that people wanted to say that and felt comfortable to bring that, I didn't even ask, is because I think they see that, oh, you guys are set up here on the street. You must care. Why would you be out here on the street like this? And I think
Mm-hmm.
that's what's
Mm-hmm.
missing from medical education, is this idea that you care, not that you have pity, like I said, not that you're standing in judgment about people's life choices, but that you just care for the humanity of the other person who could be you.
Mm.
Man,
Word.
that was very, very powerful, well put. And I know UCSF is doing it, a lot of organizations, as we continue to talk about inclusion and diversity and equity. Just having that humility, compassion, and empathy is what's needed. We got a lot of that feedback from the ladies. I was talking about when they were in labor and different things that sickle cell, that, when they're in pain and they need stuff, a lot of these hospital
Mm.
folks are judging them, thinking that they're just trying to get high and get drugs. So how
Yeah.
do we change that paradigm? Because when Black folks coming in, the first thing they think, oh, they just trying to get some painkillers, they trying to get
Drug
high,
seeking.
and they really need services. I think
Mm-hmm.
as these young folks are coming up, I know we do have a problem with substance abuse in our city and times, but how do we really give that true care to our Black and brown community when they're in a crisis, to really have that compassion and empathy for them when we're providing health services?
Critically important.
Well, I mean, I think one of the things that has to happen is the education of the providers. There's a lot of research that shows that even today, and then I'm not talking 40 years ago, I'm talking today. The most recent study I saw is like 2019. Fully believe that Black people do not feel pain the same way as other groups. They say that it is something about, oh, our skin is thicker, and some other crazy thing, and so I'm like, literally, like, what? So it goes all the way back. I mean, literally, this is current medical students believe this. and nursing students. So there is something that the psychoeducation and the significant anti-Blackness that is literally taught, whether it is taught by directly or taught by how you're in the ER and you're following around a doctor because you're the intern and you see how they treat Black people, right? You're teaching it literally and you're teaching it implicitly with bias. And I think it was a UCSF General Hospital doctor that talked about this, a South Asian doctor that literally talked about her own bias recently about this. I want to say it was in the Chronicle. But we have to do that education, right? Because obviously, if you're getting treated like you're drug seeking, and that's what they also said. The funny thing is, it's kind of saving us a little bit, although not anymore, from some of the addiction to what was that one addiction?
Opioids, OxyContin.
Well, it's the opioid, the oxy. It literally saved us from oxy because people thought that we were drug seeking and didn't give us painkillers. They didn't give us oxy. The one, like the good news, we couldn't get the oxy. So unfortunately, so we're treated significantly. And so a lot of African Americans are not treated up to the appropriate levels of pain. Very commonly, and that would include in labor and all of these other things as well. So we have to do the work on that side, but then we also have to do the work within the community as well, around some of these addiction pieces. And one of the things that, unfortunately in San Francisco, more people have died from overdose than they have died from COVID in the last each calendar year, 2020, 2021. So we have to deal with that pandemic and what's happening, and we don't talk about it, unfortunately. Oops, I lost my camera. I'll find it, but
but I would argue that those overdose deaths are related to COVID and potentially, the excess death that is coming with COVID, right? We have people who are having non-COVID problems who can't get into hospital, who end up at home with your heart attack and potentially pass away that way, or couldn't get a primary care assessment of or cardiology assessment of congestive heart failure and then died at home of congestive heart failure. I mean, so these are the excess deaths. And then you've got the anxiety and depression that comes with feeling oppressed by this pandemic and the lack of economic opportunity.
And the rabid anti-Blackness that we've seen on TV,
and the
literally seeing a man be lynched on public,
oh my goodness,
on public television, every commercial, every news article, that we were seeing, literally lynching on TV. If that doesn't make you, have some trauma, I don't know what would.
Absolutely.
Yeah. Wow. So all of that, Dr. K, and one of the things about that, so the anti-Blackness, the trauma, all of this that I want to say is we have to get real, number one, about that we're hurting. And a lot of what we've been taught is to keep the dirty laundry, and Dr. Joy DeGruy talks about this a lot, that unfortunately we have a really probably a significant issue with fetal alcohol syndrome that has been undiagnosed, and that we probably could do, because we're not talking about the alcohol. We're not talking about alcohol. We're not talking about these other drugs and other issues that people are having. And so because you say, keep your dirty laundry to yourself, don't take it out there. Don't talk about it. So we have to get used to talking about addiction. We have to get used to talking about pain, and that it's okay to ask for help and support. And that, I mean, as I was saying earlier, with Regina King's son, I mean, this is a woman, the baddest, Black woman around, who, had a beautiful child, really a beautiful man. And still, he was hurting so bad that he couldn't, that he didn't want to be on this planet, even with this amazing, amazing mother. And, we've got to get real about pain, and get real about mental health, and get real that it's okay to ask for support, and that we don't have to be the strong Black woman, strong Black man all the time, that that it's okay to say I'm hurting.
Yeah, very, very important stuff. Go ahead, Dr. Rose, if you want to jump in there, go ahead.
Well, I feel like all of these things tie together into a narrative that is, it's the foundation, right? And we don't really speak about it, and it actually fuels some people's careers, right? And remember, addiction was not something to be treated like a medical illness. When it was impacting the African American community, it was that there's just something inherently wrong with you folk.
That's right.
Right. And so just imagine to have to transition from that metaphor of why people are dealing with addiction, right, which is like you're bad, to now, oh, actually, you're not bad. You're hurting. So how long is it going to take us to get there? Right. They provided this, and especially because it was provided as an explanation as a medical illness that needs to be treated when it was really impacting the white community. And so the division is already set up. It's like, well, that explanation's not for us. We're just still bad. And I think it's going to take
a character flaw.
Exactly. It's going to take a lot to get over it, because that's what the country is continuing to try to tell Black people. And again, I just will continue to say that people writing papers about disparities and describing how bad it looks for Black people, people are getting promoted off of that. They're actually making a name for themselves in their academic field, and the academy is not truly incentivizing, like, let's promote the people who solve the problem, right? Let's not another paper, right? Let's not publish another paper publish a paper with a solution that has been tried and looks like it works, and then let's see how do we expand and generalize that and bring that solution into other spaces. I think, I feel that so much because you saw that in the beginning of the pandemic. One of the things that we immediately raised to the surface is that we're talking about, black and brown cases. And there's a way in which, like, if you get COVID, somehow you're dirty. That's another metaphor that's in the background, right? You don't need to be vaccinated because you're clean. Like, some people are making that argument, like, oh, they want me to be vaccinated because they think I'm dirty. I mean, these metaphors are divisive, okay? And so one of the things that was being said is that the infection rates in the Black and brown community, but then when you broke it down, what you saw was that, yes, there was a relatively higher rate of infections in the African American community, but it wasn't number one. And in some jurisdictions, in some counties, it wasn't number two. In Alameda County, it was number 4, right? But what was the problem? Black people were dying. Were we talking about that at the beginning of the pandemic? Like, why do people die? No. But when we did, what did we say? Oh, because you weren't healthy and you didn't take care of yourself. Right.
Exactly. There's been centuries of anti-Blackness and structural racism that have kept you down and created these problems.
Right. And we haven't figured out how that anti-Blackness and structural racism gets embodied into the other illnesses that you have. High blood pressure, diabetes, all can be tied back to cortisol and high levels of endogenous steroids. Which you will have if you're like on hyper alert all the time. Like, are the cops looking for me? Am I going to get kicked out of this store? So we haven't figured out the embodiment, but we like to tell stories that sell newspapers or get things published that just describe how terrible it is for Black people without proposing solutions or without disaggregating it. So you say, okay, we need one solution over here to prevent infection, and we need another solution over here to deal with why are people dying. So we need the structural racism informs our science and our scientific inquiry, unfortunately. And then we say, everybody follow the science.
Wow.
Yeah. So that's how there's a lot more white people that are unvaccinated than Black people that are unvaccinated. But we don't tell that story. It's those Black people that don't want to get vaccinated. Right. But in San Francisco, the largest group of unvaccinated people is white.
Yeah. No, definitely the real truth community. There's not a lie. You've heard straight truth from the horse's mouth. Two amazing folks to come on today. But I did want to do this because I want to be respectful to everybody's time. We know the Niners are getting ready to get started here shortly. Yeah, this has been a great segment of Ask Your Black Doctor. But before we close out, I would like you, Dr. Rose, and Dr. Mo to leave some parting words to the community, some positive encouragement, and or any words that you want to give, anything out to the folks before we end today's segment. We thank you for coming on, and I'm excited to continue these Ask Your Black Doctor conversations. But Dr. Rose, if you want to leave us with some parting words for the community, and then Dr. Mo, and we'll close out today's segment.
I just want to call on everybody to recognize the genius of our people, and to look for it wherever it springs up. You might be surprised by it, and try to leverage it. I hope that we can all find ways to work together where things are efficient. Whatever you can bring to the table, we can figure out how to use to advance the health of our people, because that is the foundation of generational wealth for our communities. And I think we're at a point in this country where we're being asked to step up and bring our genius to the table, to work in collaboration. And I'll leave with two quotes from Baba Arnold Perkins, who is sort of my academic muse, my leader of my community advisory board, but my academic muse. And one of the things he says is, we are not outsmarted, we are out-organized. And I think that's important to act on. And then the last thing is, my very favorite is, after all is said and done, a lot more is said than done. And so that is the ultimate call to action. Whatever the problem is, yeah, we can describe it. Yeah, we can scream about it. But the question is, what are we going to do about it? So thank you for having me today.
Very powerful words. Thank you for leaving us with that. Did y'all hear that? That was so eloquent.
I heard that.
But Dr. Rose, we are living history right here. When you talk about great leaders of the community, pillars of our community, Dr. Rose is leading the pathway, man. Thank you again for coming on today and supporting. We appreciate you and looking forward to more conversations. You have access to this platform since you're doing all the outreach. Utilize us. We'll get this information out to the community and continue to have these conversations on our educational Thursdays. Continue to bring this information to the community. That's what it's all about. Thank you again. Dr. Mo, the lovely Dr. Mo. We need some spiritual uplifting before we go to this night. Give us some last words, Dr. Mo.
Well, I want to, first of course, you see why Dr. K is my fave, and so powerful. I'm always inspired, always learn something, always inspired, always touched, always challenged. So thank you, Dr. K, for being both my friend and my colleague and my partner in crime, Malcolm and Martin, doing it inside and outside, baby. And that's the strategy, right? So I want to build on what Dr. K said about this piece of working together. And what I want to say is not only bringing our genius, but then recognizing that we are genius. So recognizing it, feeling all the feels about it, and going, oh yeah, actually I got something to contribute. I am smart. I am important. I am me. I am unique. And so when I see John Henry shining, or I see Dr. Kim shining, I see all their genius. I see all their brilliance, and I can say, oh, they're unique. They're brilliant. It doesn't take anything away from me. And this is the problem that we have with post-traumatic slave syndrome and that crabs in a barrel thing, is that we've been taught when somebody else gets lifted up, that means they're better than I am. Well, that's no, baby. We all got to shine, and we can all shine, and we all have that shine. And so we have to stop doubting ourselves, and also being able to be with each other when I see you shining, and just be like, hey, let me let you, you are shining, baby. You are shining. It doesn't mean I'm not shining, but you are shining. Let me acknowledge that. I think in San Francisco, the politics have taken over way too much, and we haven't been able to see our genius and our brilliance. So there's a couple of there's one person that always puts this up on Facebook. So I want to say shout out to Maurice Rivers, because he's always shouting out to the kings and to the queens, and just like toasting everybody. You are all shining. You are all beautiful. You are all brilliant. And that's the message that we want to share, right? Is that we all have brilliance. We all have something to contribute, and we're all pulling in a different place, that we don't need to compete. We all there's space enough for all of us, So I think that's the message I want to lift up. And then the other message I want to lift up is that we are starting 28 days of wellness with Rafiki for Black History Month. So come and visit our website, and we'll be, pushing it up. But we want you to take the challenge. So I'm gonna call both of you later and say, hey, do a little video. What you're gonna do? What does wellness mean to you? And I want to post it up. I want the whole city to get on, in the Bay Area, to get on wellness. Like, what is wellness to us? What are we doing for ourselves? Because Black History Month, unfortunately, we often are the ones who are going out and trying to train all these other people into not being anti-Black, and most of the time not even getting paid for it. So I want to stop that. I want to encourage us to stop that. Do not say no. Now, if you pay me $1 million, I'll come. But but it's like, we got to actually take care of ourselves, and that means wellness, and that means saying no to things that can wait, and just doing the things that we need to do to take care of ourselves. Like being in this beautiful community today with the two of you has really lifted my spirit. So whatever wellness means to you, I want to challenge you to lift up and join us and take a pledge for 28 days of wellness, taking care of you, me, myself, and I first. Because we got to put that oxygen mask on and take care of ourselves and not give it out. So Black history, we won't be around doing all these beautiful, brilliant things if we're not taking care of ourselves. So take care of ourselves and join the Black wellness movement. So Dr. John Henry.
Oh, I'm a doctor now. They gave it to me. I just want to say thank you again, Dr. Mo, for all of the things that you're committed to our community, especially, during this COVID, and you and Dr. Kim Emoji. This is what we really need in our community. It takes organizations to work together. Like you said, everybody has a place, everybody has a part, but together, if we unite, we can really make that sustainable change that we need in our community. It's no big egos. It's enough room and opportunity for us all to do things great in our community, but we have to be willing to be open and innovative and willing to listen and hear different perspectives and different ideals so that we can move our community forward. Health is a big thing that we got to continue to focus and highlight during this year and moving on many years in front. And we're going to continue to do our part here at both sides of the conversation to get that information out, have these taboo conversations, these stigma conversations, to make sure that we are talking about it, we are dealing with it. The only way you can heal, we believe, here is through communication. Every time you talk to your therapist, they say, get it off your chest. So that's what we're going to do here at both sides of the conversation. Our call to action is be open, reach out, speak to your providers, utilize your community organizations to get support. As you all have heard Dr. Mo say several times, there is a number of activities and programs that is happening at Rafiki. Please go to their website, check out the events and the things that they have in place for you. Utilize those services. It does us no good if we have community services that we are not utilizing. And for our young people, get involved, help out. There's a number of things that we can all do, and it's very, very important. I want to give a shout out to Roots and Dr. Noah for the work that they're doing as well. All of our community organizations, it doesn't matter where you at. It doesn't matter where you at. We just have to get involved and do the work. Our people are in need right now. We are dealing with crisis. So all of our clinicians and technicians and nurses and doctors and healers, please stay open. Our people need it. As you have heard, the suicide rate during this COVID has increased, especially in the Black community. We are dealing with anxiety, depression, the fears of the unknown, and we need our community healers and community folks to be a part of this change. Wrap your arms around somebody. Tell them you love them. Reach out to your loved ones. People are losing loved ones every day. You don't know, that one call or that one word that you say could be the difference maker of changing somebody's thought process or getting them back into the right space. So with that being said, thank you all for tuning in. This has been a great segment of Ask Your Black Doctor, as we are going to continue these series going forward with Rafiki Coalition. We are excited as we continue to talk about mental health and some of the things that continue to impact our community. We will address it, and we'll make sure that we're going to do the things that we need to do to call out in solidarity, whether it's through our elected officials or through our institution. We will stand together, and we will move our community forward. With that being said, this Tuesday, we'll have another segment of our Hidden Gems, where we will continue to highlight our Black and brown businesses, as well as our community leaders and organizations that do positive things to impact our community. Organizations like Emoji that are blessing our community. We'll continue to highlight them, let community know where they at and what they're doing. And then next Thursday, we'll have an Educational Thursday segment, and we'll be getting into our Black Panther, Black History Month conversation coming up with that. With that being said, go Niners. All of the people out there,
go Niners.
Go Niners.
Safe, enjoy the game, and hopefully we'll be in the Super Bowl. But thank you all for giving up your time today. We'll see you. Good evening, and thank everybody for tuning in today.
Black Power.
Thanks, y'all.